Hello, everyone. Welcome to the Style That Finds Us show. Today, we are here with Sakina Sabadia. She is a resident. She's in her residency. She is a doctor living in Manhattan. And we actually met this January at a concert with Machine Gum, the most incredible experience. Unfortunately, we had to lock up our phones, so no pictures were taken. So the experience is in our brains, and I tried as best as possible to speak about it and translate that, talk about it on social media. So Kina was actually in a video that Machine Gum did, a promotional video that I love. You were rocking out on a rooftop, and that was so cute. And she was such a lifeline during this whole pandemic to both of us, because I made the decision to stay in Manhattan. I thought that was the safest thing. I think in March, everyone was pretty much frozen. I didn't sleep the entire month of March. It was just so stressful. No one knew what was going on. And I didn't know if I came home, there wasn't really a place for me to be separate from them. Was I a carrier? Did I have it? I had been going out and about a little bit in Manhattan before everything shut down. And anyway, Sakina was so lovely and wonderful to answer all our questions and help ease both of our minds, because Mom was in Alabama, and for both of us, your family too, being in the epicenter, were complete panic, but they were trying to remain calm. So.
Right, and my husband would be like, "It's too late. We missed the mark. She can't come home." I'm like, "What?" You know, and I'd call your friend.
Shut the airlines. There's not going to be any flights. And
I was like, "Hey, get in the car and drive up there." But
remain calm. Well, anyway, Sakina, thank you for coming on the Style That Finds Us show today. You were the cutest, sweetest, bravest, and most wonderful person to have helped our city and during this insane time. And you are so great at remaining positive, even though you went through the darkest of days, I can only imagine. And you were so sweet to those families and to everyone around you. So thank you so much for everything that you've done.
So sweet. Thank you, Leah.
I mean, it's so true. And you are going to be a neurologist, and I have migraines. So
there you go.
And so all of a sudden, and I'm looking on social media, she's like, please, like, don't throw me into those COVID patients, because I know about the brain, but I'm not really equipped for this. And as the weeks kind of, okay, now, yes, I am going to be working with the COVID patients. So today, the conversation is going to be about that experience and what that was like. So, Bibi, do you want to take it away?
Well, so my father is a retired urologist, and my father-in-law is a retired neurosurgeon. So, you know, we're a family of doctors, but I was fascinated. I had heard about these young people that, you know, were not in respiratory medicine or whatever, pulmonology, whatever. And that they were now, because the shortage of doctors, they are being pulled in to deal with this incredible crisis, that there were so many unknowns and everything. And then they were so young, and I felt so, as a mother, just so, tender towards all of you that were so young, and you had the weight of the country, of the world on your shoulders, pretty much, of all these families, and you didn't even have families of your own yet. I mean, it was a huge, huge responsibility. And so that's my first question, is what did that feel like when you found it? Did you feel like you were equipped? Were you scared in the beginning that you weren't sure you wouldn't know how to handle all of that? And how did that work?
Yeah, I was definitely scared. I think that we had a little bit of a heads up maybe in the days before we were called in. It was really on a volunteer basis, at least at my institution, where whoever wanted to help out could help out. So I took some of the downtime that I had, because a lot of my other rotations got canceled. We had really a downtrend in our own patients coming to the hospital. Our clinics were closed down. So while I had the free time, I just took up to reading, rereading critical medicine, because I did have to do some of that in my intern year. I do internal medicine there, my training. So, but even all the reading that I could have done really wasn't enough. Once you actually walk in the unit the first time, it's nothing like anything that anyone's ever experienced before. Even the most experienced critical care physicians were saying, this is something that we've never dealt with before. To this scale, to this, if there's so many unknowns, we were still actively learning about the virus. When I would go to look up literature, I would say, look, and all of them, like a bunch of them are going into renal failure. A lot of them, their kidneys are failing. And I was looking online and I was finding no literature about that because it was just so new. And then now, of course, there are tons of studies. But in the beginning, a lot of it was sort of learning in real time. So, I mean, it was a very difficult but incredibly eye-opening experience. I definitely had the supervision and the support that I needed to get through it. It was really just about a few weeks that I was working. I worked sort of before and then through and a little bit after the peak. After that, they sort of, started to let some of us go and have other people sub in. So I haven't done that it's been about a month now.
But you were there in the most critical point.
Oh yeah.
Right. Yeah, I was in the ICU mainly, I think, where probably the biggest sort of surge was happening in the ER, which is where things are generally a lot crazier. And then once they get to the ICU, things are a little bit, I guess, in the grand scheme of things, less crazy, but still pretty hectic. The numbers of patients we were seeing was, again, nothing like we'd ever seen before. I was actually working on my own floor that used to be the neurology floor, but they had converted it into an ICU because they had to make more room for these patients.
And nobody knew at that time how long, how many people were going to be coming in. None of you knew if it was going to get worse, if it was going to, what was going to happen. So you had to just keep living in the moment, and not just being.
It sort of just had to be very flexible.
Right. I think about you in 20 years when you are speaking to groups and things like that, and they're asking you, what was your career path? And you'll have such an interesting beginning to tell.
I think so. I think a lot of us, we were joking that, in a couple of years, all the residency applications are going to say during the COVID era.
Right. Exactly. That's so true. So true.
And then, so in medical school, was this even like an option that crossed your mind that you would ever, like, nobody signed up for this. When you become a doctor, you're not like,
unless you're in infectious diseases.
Maybe so, but I think I was completely ignorant, and I just, for some reason, didn't even think in 2020 that something like this just seems so insane and impossible to make everyone stay at home and shut down the entire global economy. So were you prepared in medical school? Did they ever, I'm sure, no. Did they talk about it?
Pandemic training? I don't know that we specifically had pandemic training. I think that maybe the ER does, maybe infectious diseases does. But no, again, we've never really seen anything like this in modern times. So, no, I think a lot of things just kind of had to be figured out in the moment or right before things happened. And I think a lot of the hospitals here did really the best that they could and did a pretty remarkable job considering, how dense New York is, how many cases that we saw. I think that they really did as good of a job as they possibly could have given the circumstances.
Yeah, I think so too. I think it's amazing. The worst and the best of it for you?
I think the worst of it for me was, the fact that you can't have any families coming to visit.
Right.
And, because I'm, and I should also preface that a lot of patients that come into the hospital don't necessarily go to the ICU. They could just be on the floor, getting some oxygen through the nose, and they're there for a few days or a week, and then they go home. And then, a subset of those patients go to the ICU. So I was seeing the sickest patients in the hospital. So I was only seeing the bad cases. I wasn't seeing the better cases that went home. So I had to sort of keep that in mind. But for any of those patients, they don't get to have family coming in. And normally when I worked in an ICU, including a neurological ICU, you have family coming in, staying at the bedside, holding their hand, you get to talk to them and they get to see your face as a doctor. And having that removed, in terms of my communications with the patients, doing it all over the phone, the fact that they can't come and see their loved one or, that they can't be there for them, I think that was really the hardest part, was the sort of emotional toll that it takes on everybody, because it's the doctors, it's the nurses that are spending the most time with the patients, really, that sort of feel that burden as well. We did try, we have, some of the hospitals have iPads, or they've been getting iPads where they can at least do like a FaceTime thing with their loved one. So I've had some patients do that, or some patients' families do that, so they can at least sort of feel like they're virtually in the same room, but really nothing's a substitute for that. So that part was difficult for sure.
The pictures that we've seen, were you like in a mask type thing? I mean, was there like a real barrier between you and the sick patient too, as the doctor?
Right. So all of my patients were, with the tube down their throat and not awake regardless. So there wasn't really interaction that I could have with them
Oh, okay.
meaningfully. But not like a hazmat suit, like a sort of like a shield
Yeah.
and a mask and then a gown.
Okay.
Right. Hmm.
And it's incredible because you didn't get it and your fiance even got it, but you practiced all the safety precautions and you had all the equipment and
Yeah.
it's
I don't know how. I mean, to be fair, he's in critical care, so he's the one putting the tubes at people's throats and doing like the more high risk procedures than I was doing. But yeah, actually, I just got my antibody test back yesterday, and I'm negative, which means I never was exposed. It seems.
Wow.
Somehow. I think a lot of us are saying that's the case with the healthcare workers here, is that because in the hospital we have so much equipment, we're probably able to somewhat say a bit safer.
Wow.
Yeah. Oh my goodness. Which is crazy to think about, to grasp that
Close
concept.
to it, right?
And so tell us about mental health with both of you. How did you stay mentally healthy? Because I know this took such a toll on the healthcare workers, and some of them did, horrible things happened to them. So tell us.
I think that we, especially in my department, the ones who were deployed to the COVID units or who volunteered to be in the COVID units, a lot of our shifts overlapped. So it'd be funny, we'd be on our floor, on our neurology floor, but taking care of these patients. And because it was only a handful of us that volunteered, we sort of became like a little bit of a group. We would text each other, check in on each other. I would say, oh, so-and-so left work at 11 p.m. Her shift ended at 7. So I'd shoot her a text. And, someone would hear that I had a really rough day and then they'd give me a call. So I think we sort of took care of each other. And we really could, and at that time, we really could only talk to each other. It was really hard to talk to almost anybody else. People that were seeing neurology patients who still potentially could have COVID, but weren't really in the thick of it. I felt like we just couldn't relate.
Yeah.
Thankfully my fiance could, because he was doing even more than I could. So we could talk to each other. But if I would call home, my parents had all their concerns, all their worries. And I felt bad. After a certain point, I said, I actually need to take a space and I'll just text you guys for a few days so I can just, get a break from it. And then otherwise, when I came home, I would just find the lightest TV show and just watch it and just disconnect entirely. I wouldn't watch anything medical for a while.
Serious.
Yeah. But we had a good support system. We had some over Zoom. We had some sessions that they offered us to sort of debrief and talk about things. We also got days off in between our shifts. So we'd have like a stretch of 5 days and a stretch of 3 to 4 to 5 days off. So that was really helpful too.
Yes, and the clapping and the meals, people provided all the meals and everything.
Yeah. I mean, and it's still happening now where, at least at one of the hospitals, that, breakfast, lunch, and dinner is provided by somebody or another. And, as you guys also provided an amazing breakfast that day. And I have to tell you, the spirits were high that day. All the nurses, all the staff, all the doctors, we were thrilled. It was such a great way to start the day.
That's excellent.
It was really lovely.
Wonderful. Well, what do you feel like are there any pluses from the experience? Are there any positives?
What was the best thing that anything good come out of it?
I think that what came out was, in some sort of strange way, like knowing that we could handle this and that we could do it and that we did as best as we could. I think that, you looked at other countries, looked at Italy, and it's like, oh my God, it's devastating. And it was, at times it was really horrible, but at least from what I could see, I thought that we were as best as we could be, given the circumstances, given the resources, we're as prepared as we could have been. We protected our workers as best as we could have, all the way to, it's like the doctors had equipment, the nurses had equipment, the respiratory therapist, the guy that was cleaning the floors, the one that was in the elevator, transporting the patients, they all had masks. And that made me so proud to think, okay, we're protecting everybody. We're treating everybody the same. And then the other thing was, because at that point we were all a little bit panicked and wanted to do the best for our patients, a lot of sort of the formalities of our care came down, and we're just like, okay, instead of calling a formalized consult or, kind of going through the hoops of calling a formalized consult, this patient needs dialysis, what can you do for me? And then it's like, well, usually we have to go through A, B, C, and D, let's just go straight to B and take care of the patient. And I think that was a really nice thing that came out of it too. It was sort of like the whole hospital was working together towards the same common goal.
And then it is like they kept calling it a war. So in the end, you're like, we survived. We really did this. I did this, and I made these. I would think the bond that you have with these people when you see them forever, you went through this thing together that's hard to explain to other people. And everybody will ask you about it forever.
Yeah.
Because we were all so, glued to our TVs thinking, what's it like in there? What's really happening in those hospitals? So that's why I'm so thankful that you're here today with us, just to kind of talk to us a little bit about it, so we can share that with the other people who, have just heard these stories and just don't know what's going on in there. Right?
Yeah. Do you think you've made some lifelong friends?
I think that the residents that I worked with that were already from my program, we have a much tighter bond. I think because of this.
And what do you think about what will change maybe in medicine going forward, or how hospitals operate, or anything?
Yeah. I think one big thing that came out of this was because we couldn't keep the clinics closed forever, that, at least I think not just neurology, but other departments switched to telemedicine, meaning, video calls. And I think that's something that we were talking about doing anyway to help with our patients who maybe have difficulty physically getting into the hospital, maybe due to disabilities, or they live really far and they want to get a specialist opinion, or like maybe it's something that we don't really need to physically see you for. Let's just do a phone call or a video visit, which I actually just did a couple of days ago. And I think that we were talking about it and we're going to study it, and then when this happened, it's like, all right, we have to just roll it out. We'll study it later. And so that's exactly what happened. A lot of the clinics initially closed and then canceled their patient visits, and then converted to telephone visits or video visits. So I think that's going to probably stick around even once we're able to have patients back in the clinic.
Yeah, I think that'd be a great idea. I really do. A lot of people just don't feel good enough to come anyway. But it might just be a bad cold or something, and also, like, sometimes you have to go to this doctor just to tell you, recommend that you go to the orthopedic surgeon, whatever it is. So pay that copay just to get the approval, and then go there, and all that stuff. And so I think that it can free you all up to see, more patients, I would think. And,
Yeah, I think it'll improve access to care, I hope. Yeah.
Oh my goodness. And then can we talk about college and med school, where you went and why you made the decision to become a doctor?
Yeah, so I went to college back in Southern California, where I'm from, and I initially, back in the day, was thinking I'm going to go into journalism. That was my initial path, and I think that I, wanted to travel and report on world news, and if there was something that people weren't paying attention to, I'd want to bring attention to it. I was a bit more of an activist, I think, back then, and I don't really have a good explanation about how I fell into science. Essentially, I was trying to finish my science classes so that I could do my prerequisites and then go do my communications major. And as I was taking those classes, I fell in love with them. I think that's essentially what happened. As I was trying to get them out of the way, then I was like, oh, this is so cool. Especially I took a class on human physiology, on the biology of the human body, and I thought, this is fascinating. And somehow, I ended up switching to pre-med, sometime in, I think near the end of my first year of college. So I did a total 180. I think some people in my family sort of saw it coming. They were like, oh, she's probably gonna be a doctor. I'm like, and I was really against that. I was like, no, I'm gonna be a journalist. I'm gonna do something that's totally different. And then I ended up just kind of fitting with the mold. So, but no regrets. When it came to going to medical school, I applied all over the country, but I did want to leave, the West Coast and get a different flavor. And so I came to New York City actually for medical school. Then I've, been here ever since. So it was 4 years of medical school. Now I'm ending my 4th year of training. So it's 8 years in New York, doing all of my training. And I'm really happy with it. I think that it was important to, obviously, I'm happy that I made that decision in my life to be a doctor. I definitely feel that I made the right choice. And then to sort of also leave home and to get this independence that I think I really needed. It's, as you know, Delia, it takes a certain person to make it in New York. You have to be strong. And I think that it definitely hardened my skin, but it was important.
Oh my gosh, for sure.
Yeah.
And so now that things are getting better, we seem to kind of flatten the curve, but they have not yet started easing the restrictions and starting phase 1. But as you can get back to your residency, what are you most looking forward to about neurology and being a doctor?
Sure. So I'm starting to take a call next week. where I'll get to do 5 days on call for one of the hospitals where I'm there during the day, but taking phone calls at night. And it's sort of like almost like I'm taking a step up, like I'm an attending for that week. And I've done that rotation a few times before, and I ended up picking it up because one of my co-residents is pregnant and we don't want her in the hospital.
Sure.
So it's an extra sort of week of work that I'm doing that I'm thrilled about. I love it. I get to see all sorts of interesting cases. I get to be the consultant. It's a really cool rotation. And then, sadly, about a month and a week now, I'm going to be graduating, and I start my next phase of training, which is, neuromuscular diseases, where I'll be learning how to do EMGs and nerve conduction studies. It's a very, interesting field that I get to, do a year of training in. That starts in July.
So what is that? Is that like, are you in your residency right now?
Mm-hmm. So that'd be a fellowship.
Like a fellowship. Yeah, that's
Mm-hmm.
right. Okay.
I'm looking forward to that starting, and that'll be in July.
And that will be in New York?
Mm-hmm.
Okay. And your fiance is in New York as well, obviously. So.
Mm-hmm. And he's actually in his fellowship for pulmonary critical care.
And do you have any idea whether you all will stay in New York or?
I think for the short, long term, like for the next few years at least, I think so. We both love it here. He still has his training left, and I wanted to finish my training and work here as an attending at least for a few years.
Yeah.
After that, I think it's hard to say. It's hard to think about leaving New York. I'm not really done with it yet.
Right, I agree.
You can always
Yeah.
come back. We don't want to lose you.
That's right, definitely.
Yeah,
Which
I
is
love it here.
because like the reason why we live in Birmingham, Alabama, my father went to Tulane,
Mm-hmm.
to the Ochsner Clinic, and Dr. Ochsner was alive, obviously then. But there were too many urologists in the state of Louisiana, and there weren't enough in Alabama. So he moved to Atlanta to take his job. So that happens so often. So you don't know where you'll end up going. But what did we ask other questions? Else, I'll make sure. So you do feel like things are like there are less patients now?
We don't have the influx that we had before. That's gone way down. And where some of the floors are converting back to what they used to be. So the ICU is sort of shrinking a little bit, which is good. That's what we were hoping for.
Yes, that's huge. Okay, so that's another thing too. So what I was explaining to somebody, maybe Dave, I can't remember, but when things are opening back up, it's not going to mean that there will not be any more COVID cases. It just means that things have slowed down enough that it's manageable in the hospitals. Correct?
I believe so. Yeah. And also I think that there's, at least for Cuomo, there was some list of requirements for each section of New York to reopen, including some set number of 100,000 cases, at which point it would be, unlikely to spread that easily to kind of, cause another peak. So I know some areas have already reopened. I'm curious to see what happens in the next few weeks in those areas. Yeah, so we'll see.
We've been out to lunch. We've been to a couple of shops. Obviously, we've worn our masks, and it's not been many other people in the stores. Still a weird feeling. Memorial Day weekend, we're at the beach. Yesterday, we were at a marina, and there was like a tiki bar thing, and there were a lot of people in there.
Oh, really?
And they didn't seem to be distancing, and some didn't have on their masks, and it was like seeing something out of the past or something. You're like, whoa, there's people near each other.
I know.
So it will be very interesting to see, but it's hard to know. More testing is being done at the same time, so more cases anyway. So how do you know which is which, right?
Yeah, I don't know. I think it's going to be really hard to say. I think even now, even though things are mostly closed, I'm still seeing clusters of people that are sort of ignoring the distancing and not wearing their masks. And it's a little bit frustrating because it means that I wonder if what they then lift some restrictions, is it just going to be like all hell breaks loose? I don't know. I think I'll probably, I'll generally stay more on the cautious side and then observe and see what happens. And if things really are okay for a while, then sure. But I think that we don't really know that yet. This is still a big unknown.
Yeah, I think it's interesting about this race, this race for the cure, this race for the vaccine internationally. I heard someone yesterday say, "Oh, I know we're going to have a vaccine by the end of summer." I thought, I don't know about that. Yeah,
usually it takes a while to develop a brand new vaccine like that. So that would be lovely. I think it'd be funny. It'd be great if they, keep racing each other and whoever gets there first. Then great, but it's got to be tested. It's got to be safe.
They seem like they keep coming up with new symptoms too. The things that are happening to kids. and then
I know.
and then the
Pink eye?
swelling of the fingers and toes are numbing.
Yeah.
Did you feel like every day they were saying, now be looking out for this, or by the time they got to the ICU, they had figured it out? They had it.
We normally knew once they got to the ICU, we knew that they had it. In terms of things to look out for in terms of complications, that's what some of them we were learning in real time, and some of them we were sort of warned about a little bit before. Like as I had mentioned, the whole, effect on the kidneys, we were learning about because a lot of them were going into kidney failure, but there wasn't literature about it yet. So I think that's probably been happening with other organ systems too. We're learning more about rashes, the toes thing I think you heard about as well. As a neurologist, the effects on the brain. So
I don't know about the brain. Like you would come into your shift and they would say, by the way, heads up, we're seeing a lot of renal failure or whatever.
Mhm.
Like that day you were living it in real time.
yeah.
Yeah. Fascinating.
Well, thank you so much for coming on. I'm really
Yeah.
Proud of you.
Thank you for having me.
I think sometimes like it's going to take a little while for you to really see what you did. When you look back a year from now and you think about it and you've had some time away from it and everything to process it, and you look back and think, I cannot believe we did that. I cannot believe we grabbed it. I cannot believe we banded together like that.
Yeah.
I think that you will have learned so much from it that you don't even know you learned at this point. I think it's kind of when you're in there, you're just reacting. Your brain is just working.
Oh, absolutely.
Going and going, and then catching your breath, and then back in again, and having that time to. I don't think the human brain can fully process things when they're in the middle of something that's completely novel.
Right.
Well, we're very proud to know you.
Thank
you for everything. And y'all have a wonderful weekend. And tell
Thank you.
your fiance, thank you for what he's done too.
Of course. Thank you for your support. You guys are lovely.
So are you.
Well, thanks so much again.
All right,
Bye-bye.
Bye.